Cardiac arrest at work. Her relatives were stunned to learn that no one gave her CPR for more than 7 minutes.
Her family is questioning how that's possible at a facility connected with a highly regarded cancer center. The woman, who was devoted to her family and her patients, is now quadriplegic. Her workers' comp claim denied by her employer.
We have a warning now. Some of what you're about to see is difficult to watch.
She loved being a nurse. She really wanted to help people.
Andrea Morris lived an active life, working as a nurse, running marathons, and raising her 3 children as a single mom. But all that changed May 14, 2020. Andrea arrived to work at the City of Hope Cancer Infusion Center in Upland. According to court records, she told her supervisor, also a nurse, that she didn't feel well and worried she might have COVID, a constant concern in those early months of the global pandemic. Pam Bertino is Andrea's sister.
She was really worried about her kids and getting it from a patient or another medical professional and then giving it to one of her children.
So a lot of anxiety and stress.
A lot of anxiety and stress, just all the time.
But the symptoms Andrea worried were COVID-related turned out to be the first signs of sudden cardiac arrest. What you're about to see is difficult to watch, but Andrea and her family want you to see it.
She is literally moaning.
Nursing supervisor Karen Cerna recorded Andrea's medical emergency on her cell phone as she called 911. Both recordings shared with the I-Team by Andrea's attorney.
I can't get a blood pressure on her. She's completely moaning. Right now, she looks like she's having a seizure.
Nurse Cerna mistakenly and repeatedly referred to what was happening as a seizure, but not getting a blood pressure reading, even manually.
I'm not seeing her move at all.
She's not breathing?
No.
In an ongoing workers' compensation trial, Nurse Cerna was asked by Andrea's attorney, once you couldn't get a reading on her blood pressure, it's a fact you didn't start CPR. Correct. This was a missed opportunity to save her, wasn't it? She responded, I don't agree with that statement. When asked, can you explain how videotaping helped her in that emergency situation? Did it help with her breathing? Did it help with her getting oxygen to her brain? Nurse Cerna said no.
It's really scary to think that your boss would take a videotape of you essentially going into cardiac arrest and having agonal breathing instead of reacting and giving CPR.
Attorney Keith Moore points to repeated failures to properly assess Andrea and to react.
There were 6 different chances she had to recognize, do something, but she did nothing.
And he says witness testimony shows it wasn't just her supervisor, Nurse Cerna, who was present.
There were 2 nurses, 1 medical assistant, and 2 doctors, all City of Hope employees.
One of those doctors later saying under oath he was not qualified to perform CPR.
There was a defibrillator very close by, oxygen very close by, and they just didn't react. And to me, it's the biggest mystery of the whole thing. She was dying, her lips.
First of all, they decided to record this lady having a seizure instead of helping her. No CPR, no nothing. Second, the doctor who was available stated that he wasn't able to administer CPR. Something is going on here, and the family needs to sue so they can get the most they can for this lady, because that is messed up. All the staff members failed her, and then now she had to suffer all the consequences when they could have took at least a few minutes out to help her instead of recording her and stating they can't help her. Let me know what you think.